don't want to, and that was our problem in the 30s. We pushed this up, and we interfered too much and didn't allow the liquidation. Now,
we're not seeing inflation yet. The CPI is not showing that.
Yeah, well, there's two things. First, the CPI is totally unreliable. If you go to the old recording of the CPI, it's 8 or 10%. People still measure it by the old CPI, and a CPI is very generalized because if you're retired and you're on Social Security and you have heating bills and a medical bill and a repair bill, your inflation rate might be 15%. Inflation has to be measured by the increase in the money supply. That's the dilution of the value of the dollar. It's the malinvestment that is the real evil, the pumping up certain industries. But in housing, I mean, we had horrendous inflation in housing prices. So when the government inflates the currency, all prices don't go up the same. Electronics go down in price. You know, computers, still, you can get deals. Prices go down. Cell phones go down. At the same time, when governments direct where the money might go, say into medicine, cost goes up. Even, it might go into financials. It might go into education. And our housing programs. You know, you have the misdirection from the excess of credit, which is the most serious problem. But then on top of that, you have the housing programs that said you will make these loans. They're talking about the subprime loans. But by law, these banks have to make some of these loans. You know, you can't discriminate. So they force people to go in and make bad loans, and then we have to bail them out. So that means there's more money flowing into it, and that's why prices of houses, you know, go up much faster than the cost of rent. Matter of fact, you know what they did, like CPI, during all those, you know, increases in the cost of a house, they didn't even put cost of houses. That's not even in, you know, the CPI. But Alan Greenspan, it isn't so much that he didn't do enough to deal with the housing bubble. He created it. It was his low interest rates of 1%, which generated very low interest rates. So that fed through the market, and we had our interest rates down to 4.5% on a mortgage. You know, in this age when the dollar is losing its value, I mean, this was astronomically low. And people do the wrong things because the information you need to get to make an investment is to find out how much people are saving. We don't save, so everything is artificial. And that's when people make mistakes. And people made mistakes buying houses when they shouldn't have. And they were many times tricked into it with you know, promises of, you know, a wonderfully low mortgage payment that they don't emphasize in 2 years you're going to have to pay a lot more. So it was a combination of housing programs and policies as well as the low interest rate. So the prevention is much better than the cure because the cure is just devastating because the cure is allowing the market to liquidate bad debt. That's what the market wants. Politicians say, keep the bubble going. And that's where we are today. And they're bailing out. I mean, what was this operation just last week? The $90 billion project of all the international, all the international central banks. I mean, this is very big. The other big change on monetary policy, it's not. We don't quite yet see the evidence. It has been the opening up of the discount window. The discount window has always been used for banks on their last legs. They can go and they can borrow. And it's always been, you know, oh, my bank's in trouble. I don't want to borrow from the discount window. But now they've changed that whole attitude. Please come to the discount window. Bring us all your bad debt. Bring your mortgage securities. We'll take anything. And they can get bailed out, and banks have still been reluctant. And that is what they're trying to do. That's why they're facilitating. They're changing the nature of the discount bank so they need that in addition to just lowering overnight rates. And that's just inflation. And this is what I got after Bernanke for the other day. I said, how can you solve the problems of inflation with more inflation? The markets want deflation. It's politically unacceptable. That's why expect more erosion of your dollar. Okay, go ahead if you have somebody there. I see in the middle back there. There we go.
It seems that Bush hasn't really done anything.
A little bit louder and microphone up.
Seems that George Bush hasn't really done anything for office. Do you think our country's ready for another Republican president?
How about another Republican president from Texas? Well, I guess if it's a different kind of Republican, if it's a traditional Republican, a constitutional Republican, somebody that wants to change the foreign policy and who wants to fulfill the promises of George Bush of the year 2000 about a humble foreign policy, I would think that whether they're from Texas or whether they're a Republican or Democrat, I think the country is ready for that. Okay, go ahead.
Since you're a physician, I would be interested in hearing how you would address the spiraling cost of health care. Mayor Giuliani seems to feel that tort reform would do the trick. Governor Huckabee seems to feel that focusing on wellness is a positive direction, and Governor Romney seems to feel that mandatory health care insurance is the way to go. So I'd be interested to hear what a doctor has to say.
You cannot, and this is a big problem, and probably second or third in the number of concerns that the people are talking about is medical care. You cannot talk about the cost of medical care without addressing the subject of basic monetary inflation. Same as housing. You know, you pump money into it, and the government programs do it. You have the money out there, and cost goes up. So costs are going up because of inflation, and you can't solve all that problem unless you deal with monetary policy and deficit financing. But government tax code has been the real culprit, and the takeover of medicine by government since 1965, especially since in the early 1970s, with our tax code and ERISA laws that mandated that large corporations provide certain types of services at the same time they got the tax benefits, where the small companies and individuals did not have the same benefits. And it caused a distortion. It caused prices to rise to the point now where the corporations want to get out of it, and that's why they get behind prescription drug programs so that they can dump some of their responsibilities on the government or the taxpayers. So one intervention leads to more problems and more intervention, and that's where we are. So most people recognize that we have a mess in medical care. We have corporate medicine today, corporatism. We have put somebody between the doctor and the patient. I've no longer had the control over what I do for my patients. I have to call some clerk in California belonging to an insurance company to decide what kind of surgery we're going to have. I mean, it's a horror in practicing medicine. But it's costly, too. They say that that's to cut down on costs. But the corporations make a lot of money. That's why they spend a lot of money lobbying. So once we notice the problem, now there's a clamor for even some of the Republicans saying what we need is a single health payer. And that's socialized medicine. They call it single health payer, but they're talking about socialized medicine. Most Americans don't believe in socialism. Some people don't believe in socialism except for medicine because they think medicine is distinctly different and that the market can't provide it. But the mess that we have now could be corrected by changing those tax laws, making sure that the individual gets the benefit, not the large corporations. Make sure that every single dollar you spend on medical care can be written off or have these health savings accounts where you get the money, young people especially, they ought to get the money, put it in the bank, not have to pay taxes on that money, not pay taxes on what it earns, and let them pay for their services. We don't have insurance. If you can have an insurance policy that says you only have to pay $5 to see the doctor or $5 to go to the pharmacy, that's not insurance. That's prepaid services. That the insurance company can't measure risk. Insurance should measure risk. Accidents and catastrophic problems and intensive care and hospitalizations. And then an individual who could put their savings aside could buy these major medical policies. But we have lost our way here because we lost our confidence, and not many Americans believe that people would be taken care of. But I happen to believe that. It happened before. People weren't out on the streets. I can remember working in a hospital for a couple dollars an hour in the 1960s before all this started. It was a church hospital, and nobody was turned away. Nobody was put on Medicaid immediately. Today, everybody's put on some program, a government program, and then do you think that the hospitals then charge the least? No, you charge the most.